You've been fighting your whole life, Janine. Fighting your whole life, right? I want to go back to the 15-year-old girl. If that 15-year-old girl was to see who Janine becomes today, what do you think she says?
Hmm. I have more like advice for her than I don't. I
Well, let's
don't
hear it.
know.
Let's hear it. What's the advice? What's the
I don't
advice?
know what she would say, but my advice to her would be recognize your worth, right now when you're this
Yeah,
young,
yeah.
traumatized girl, and
Recognize your worth.
hold that out. Like yeah, I think I would have wanted to know that, but I didn't at that age, and nobody taught me that.
No, not at all. I kind of go back and I share the stories that I think at some point our confidence was stripped away from us. And we had to learn our confidence, our worth, our value. I think we had to learn that. And even though I think we had it, we couldn't tap into it because we didn't even know what that looked like, you know. And but we're in spaces now that we walk with confidence and we see people for who they are and we're uplifting. And I just think about, man, you've been fighting your whole life, and here you are still fighting because you realize that life is not even about us anymore. It's about those that come after us. It's about our kids. It's about people that we meet in the streets, as you mentioned, that they need that second chance. And you're a believer in second chances, aren't you?
Absolutely. Yes.
Yeah, yeah.
Absolutely.
Me too.
And you know what? It's a slippery slope because as soon as you
Mhm.
try to point and say them, those people, you're just
Yeah,
about a hair and a breath away from it. And I can say that even when when I was diagnosed with end stage cancer, I had just moved to the Baltimore area and I didn't have a job and no health insurance. And guess what? I was a person who, if I didn't get medical assistance at that point, they would not have given me that bone marrow transplant and I wouldn't be talking to you right now. At the last minute I got it. But, it's not them, it's all of us.
yeah.
Like nobody is immune from what the world can deal out and what can occur
Yeah.
to you.
I love it. I love that what we're sharing here because so many people probably feel alone or feel like there's no light at the end of the tunnel, but we're both testimonies of that there's light at the end of the tunnel. That you might be in a dark moment today, but one, there's resources. There's resources such as your organization. There's leaders out there that truly care to make a difference. Not so much about a paycheck. I think but things I've been saying lately is that people like yourself, you don't chase a paycheck. You chase purpose. You chase passion. 'Cause let's be honest, Janine, you can be working somewhere else making a lot more money, but it's not about the money for you. Never has been. Right. It was always about how do you uplift others, and I really love that you're in that space. I ask you, we talk about the cuts that are happening at the government level. I see that organizations, and not just only nonprofits, that you mentioned the healthcare. I mean, people personally that are scared to go to a doctor because they don't know if they're going to be taken away from their families. Right. Like that's where we're living at in this time of day. But when it comes to the sense of the nonprofit, where we are having to cut maybe programs or cut people, are we implementing AI to try to fill that void? Is your organization looking towards that? And
I
if so,
think
what kind of AI tools?
Yeah, and actually, that's something we're working on now. We just finished a strategic technology plan, and so
Hmm.
one of the things we're focused on is what is our AI protocol. How do we want to utilize it? And so, but I know that the leadership team uses it in various ways to have more speed in the clunky things we have to do,
Yeah.
especially analysis and
Hmm.
that type of planning. It has saved a lot of time for us, but
Yeah.
we're going to be doing more. We just need to lay it out. And as I said, there was a lot of infrastructure things that I've been working on since I came.
No, I believe it. I believe that even in the healthcare, when I talked about healthcare, pandemic happened, we lost so many people in the healthcare industry, and I believe, and I'm hearing from other leaders, is that people had to do the things they didn't want to do and were not happy about. So they found other careers, maybe doing their own things. And it's that admin work, it's that busy work that we don't love doing. We love to help people, and we get taken away from that. It doesn't become enjoying anymore, right? So we can find tools that help us save time, as you mentioned, save time doing the little things that just doesn't really make sense to us because we want to be on the front line. Like, yeah, let's implement those things. And how do we even implement AI to continue to communicate with our communities? Like, there's so many different tools, as you mentioned. It's having to find that right partner, that right tool. And but I love that you guys are in it, thinking strategic, because there is a lot of organizations that are already kind of rolling it out, already implemented these things. And AI to me is almost like the social media. You know, when people say that when I remember the first thing, MySpace. Remember MySpace
Oh
days?
yeah.
Now we're on Facebook. Now we're on Instagram. Now we're on TikTok. Like, it's really evolved. I mean, the computer has evolved, and thinking that AI has truly been here for some time, as in text predictive, predictions, but we haven't called it AI. So I love that you guys are thinking about how do we continue to move with the times,
Hmm.
and help us become better versions of ourselves, but also help us do what we love more and let the AI automation take care of the things that we can just automate in a sense, right? So
Absolutely. I
I
think
think it's cool.
you've done a good job of that just from my little interface with how you work, and I really liked that.
Oh man, yeah, 100%. What's crazy is that 3 years ago I had a friend tell me about ChatGPT, and like probably everybody else, I'm like, oh, that's cool. Never really used it. I would tell people about it, but never use it myself. And within the last, I would say, year and a half, I mean, it becomes my personal assistant.
Yeah.
And working on automation, and these are the things I didn't even never knew, but I had to learn. And I see the benefit of it and the time that is being saved. So I always love to also spread that to the nonprofits.
Hmm.
If someone is listening right now, Janine, but they're barely holding on, what would you want them to hear from you today?
Something that you said earlier, you said life is like a roller coaster. Every day is different. So, first and foremost, recognize that tomorrow is a new day. You're not going to
Mm-hmm.
feel the way you feel today. You'll feel differently. And I really want people to hear that who might be considering suicide, taking their own life, to realize it's not the end of your story. And there are many, many people here to listen to you. One, most importantly, you can call 988. It's a crisis
Mm-hmm.
line that is always answered, and people will work with you. At Mental Health Partnerships, if you go to our website, which is mhphope.org, you can get a
Mm-hmm.
chat line and you can literally chat with somebody right away. You can also call in to get support, and we'll be able to route you to a program that could help you. We have certified peer specialists that could work with people, case managers. We have recovery learning centers where people can just drop in and immediately get support. So there, it's an easy entry. It's not like trying to sign up to get a psychiatrist, which could take 6 months. We have something for you today, and we can walk with you through your journey.